With aging, there's a natural decline in physical ability, and this may be seen as difficulty walking a quarter of a mile, climbing up steps, carrying groceries. And what can happen is that a person can progress from having difficulty doing these activities to the inability or disability to perform these activities, which can then result in a loss of independence. And the good news is that studies show that exercise and physical activity can improve physical function and can reduce the risk of developing physical limitation. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in orthopedic surgery and sports medicine. Older men and women who are physically active or doing exercise 3 or more days per week have been found to have a lower risk of losing their mobility, ability to move around, compared to their sedentary counterparts. And some studies suggest that reduced risk is 40% lower. Let's look at the benefits of exercise and physical activity over the course of time for any one individual. So let's start with those people who are over the age of 55. Studies show that for men and women who are physically active, in men, it can reduce their risk by 37% of developing some physical limitation, and in women, about 53% reduction in developing a physical limitation. Moving up the age categories, for those people who are 70 and above, for the groups of people that are very active, they have a much lower risk of developing a physical limitation, and studies show that 5 years following those people, they have about an 80% reduced risk of developing a physical limitation compared to those who are not active. And looking at people who are both lower than 75 and higher than 75 years of age, there was an interesting meta-analysis that followed these people for over 10 years. And they found that those people who were engaged in high levels of exercise and physical activity have a 50% lower risk of developing some disability in basic activities of daily living. Things like bathing, washing, clothing, those type of issues. Now let's follow these older people all the way out to the end of their life. And we find that the probability of a 65-year-old man surviving to 80 and being non-disable prior to death was only 26%. And for a 65-year-old woman, the probability of surviving to age 85 and being non-disabled before death was about 20%. However, there's good news. Physical activity and exercise improves these odds dramatically, and studies show that there's nearly a 2-fold increase in the likelihood of dying without any disability among those who are most physically active compared to sedentary older adults. These findings are encouraging because it indicates that some form of physical disability prior to death is not a necessity, and that doing physical activity and exercise can help prevent that from happening. For those older people who have been living a sedentary lifestyle, don't be discouraged, because studies show that for those people who change and introduce physical activity and exercise can reduce their risk of developing a physical limitation by 50% in the future. We just completed talking about how physical activity and exercise can help prevent developing some sort of physical limitation. But what about people who already do have some physical limitation or disability? Here too, exercise and physical activity can help improve their situation. And we see this in 2 ways. 1, it can actually help improve function, and 2, it can actually slow the progression of a disability. For example, there was a study of 645 older men with some mobility limitation, and what they found were those that introduced moderate intensity exercise were 2.5 times more likely to recover their mobility function compared to the sedentary group. The second benefit of exercise is its ability to slow the progression of a physical limitation or developing a disability. And a meta-analysis looking at people younger and older than 75 years of age and followed them for over 10 years found that the group of people that did have a physical limitation but were being physically active and doing exercise could reduce their risk of progression of that disability by 55% compared to that same age group that was being sedentary. What type of exercise program is ideal for resolving or preventing a physical limitation? And studies show that aerobic training, strength training, balance training, and best of all, a combination of these different exercise programs can really help prevent and resolve a physical limitation. In this video, I'm going to focus on aerobic training, and we'll discuss strength training in another video. A very commonly performed aerobic activity is walking, and walking has been shown to help reduce the risk of developing a physical limitation. For example, one study compared a group of older people that performed regular walking versus a group that was sedentary. And the exercise walking group exercised 3 times a week, 40-minute sessions for about 16 weeks at a moderate intensity, which is about 60 to 75% of maximum heart rate. And then what they did is they evaluated 10 common household tasks performed sequentially, and they calculated a score to see how well they were able to perform those functions. And interestingly, what they found was that the walking exercise group significantly increased their functional score by 25% versus an 8% decline in that sedentary group. Similarly, there was another study of 3,800 people over the age of 70, and they found that the group that was walking 4 to 7 times a week had a significantly reduced risk of the onset of a disability by up to 80% compared to the sedentary group. So that's a significant benefit. How much exercise do we need to perform to gain these benefits? And studies show that the greater frequency per week that we do exercise, and for the longer sessions, we will see larger beneficial effects. And in the 2 studies that we just reviewed here, we showed that exercising at least 3 days a week for 30-40 minutes of moderate intensity walking, and better yet, 4 to 7 times per week of this moderate intensity walking will help give us these benefits. Another type of exercise, which I didn't go over in this video, is balance training. And studies show that, again, performing these exercises 3 days a week for at least 90 minutes a week have been actually shown to improve balance, which is important for activities like walking and other activities of daily living. Throughout this video, we've been talking about how exercise can improve physical function and prevent physical limitation. Now, how do we measure this? And there are 2 ways. One, questionnaires, where patients will answer questions about their physical ability and limitations and how much exercise they do. And we can also perform a test where we physically will monitor how they can perform different activities. These 2 different methods are valuable, one giving us a subjective view from the patient's perspective, and the other one gives us an objective evaluation of what they are able to physically do. Let's wrap up this video and go over a few key points. Number 1, prevention. So exercise and physical activity could prevent the risk of someone developing a physical limitation or disability. Number 2, exercise is treatment. So for those people who already have a mobility limitation, exercise can improve their function and can also slow down their progression. Number 3, a combination of aerobic exercise, strength training, and balance training are all recommended. Number 4, the more active you are, the better odds that you maintain your physical function. Thank you for watching this video. If you found value, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.